Hello, everyone. My name is Adam Okada, Clinical Education Specialist with Healthmark Industries, and you're watching another quick tips for the sterile processing department. In this video, we're going to determine what does non-linting mean. We see that terminology in our standards or in our IFUs, but it often gets confused with lint-free or low linting. So what does this terminology of non-linting mean? We see it in cloths and wipes. We're going to try to help define what non-linting means, what lint is in the department, and then again, what is the difference between lint-free and non-linting when it comes to our standards and our instructions for use. So again, lint within the healthcare industry is composed of fine fibers that separate from items like wraps, towels, and other textiles. That lint can be carried on air currents and deposited anywhere, which can obviously be a negative thing when you're inside of an OR in a surgical case. If that lint gets open, say in a tray, and gets opened on the sterile field, that lint can settle into a patient wound and cause a surgical site infection. And there are various types of woven and non-woven materials when we talk about linens and cloths and other things. Woven materials are essentially sewn or interconnected together, and non-woven materials are bonded together using either a chemical, mechanical, or some type of solvent process. But whether they're woven or non-woven, both of them are using very, very fine fibers that are essentially going to be put together to create this larger thing. The one thing I'd like for you to consider when we're thinking about this terminology of lint and linens and non and woven materials versus non-woven materials is that if you have a favorite shirt, for example, something that you wear quite often, over time you're going to see pilling or you're going to start seeing tears or little things coming off of it. And again, that's the fibers of that material essentially shedding over with wear and tear over time. With excessive usage, just about anything that has fine fibers will start to lint. So, this terminology of lint free is not exactly what we're going to be looking at. And again, we're going to go into that a little bit later on. Lint free just isn't really a thing when you have woven or non woven materials. Why is lint dangerous? Well, again, we talked about it can settle in a surgical site infection. Lint and airborne particles can carry microorganisms. And this is actually from an article by Wava Trescott from the clinical issue. And you can actually see the lint fibers there with magnification. You can see bacteria actually growing on the lint fibers. Obviously, very dangerous. Bacteria loves to hide in places where it's dark and damp, where it can get in and get protected. And inside of a piece of lint that's floating in the air, that's a perfect way for them to travel. Again, from Amy ST79, it states that non linting materials are recommended because lint can be introduced into a patient wound and cause a foreign body reaction. We saw that bacteria in there. Obviously, if it can settle into a patient wound, it's going to cause some problems once it gets in there. What type of problems? Again, from that article from WAVA, we see lint and fiber associated complications include increased incidence or severity of infections. It can cause blood clots, can also be amplified inflammation, poor quality wound healing, granulomas, as well as adhesions. A lot of dangerous things can happen just from lint inside of our trays or inside of our sets. So, what is a non-linting wipe? What does that terminology mean when we talk about non-linting wipes? Well, for maybe ST79, cloths used in decontamination should be clean and non-linting and should be changed frequently. Now, that's an excellent terminology or a way to describe what a non-linting wipe is. It should be clean, it should be non-linting, meaning not actively linting, and it should be changed frequently. Like we were talking about before, anything that's made up of fine fibers will start to lint eventually. So that terminology of lint free doesn't really apply because again, anything with fibers is going to create lint. A non-linting wipe, that's we want something that's not actively linting right now, and that usually means it's relatively new. Think of a towel that's just gone through hundreds of wash cycles. We've used it over and over again. All the friction and all the things that have happened to that towel over time, just eventually lint is going to start uh, being created on that towel. So again, over time, all of these things are going to create lint. There's no such thing as lint free. So when we see that terminology or surveyors come into our departments, why do they say, well, you need to use a lint-free towel? And again, that's kind of a misnomer. It's not such a thing as a lint-free towel. So that terminology actually came from 2010. The AMI standards actually stated utilizing lint-free cloths to wipe down instruments and scopes for decontamination. Now, during the 2017 update to ST79, there was many terms suggested to replace lint-free. Low linting was one of the popular choices used to replace lint-free. But the AAMI standards experts settled on the term non-linting to replace the former term lint-free. And while there's no definition of non-linting in the AAMI standards, the writers of the standards stated that there really was no such thing as a lint-free cloth, and thus they created this sort of terminology of non-linting, not actively linting right now. So why do our IFUs tell us lint-free? And unfortunately, if it was written prior to 2017, that terminology of lint-free is probably there because of the previous wording in the standards. Again, the consensus of AAMI members, there's no such thing as truly lint-free cloth due to the fibers that make up cloth material. So there you can see on the screen, if visible moisture is present, you dry the instrument with a clean lint-free towel. You'll see that in the IFU. In that case, lint free essentially means non-linting. You want it to be not actively linting right now. And if you want to take a deep dive into non-linting, lint-free, all of these terminologies, I would suggest going to the ISO and European standards. So again, ISO and European standards have actually done extensive scientific testing on textiles to determine lint and other particles generated from a dry state. And not to get too far into the weeds, it's actually a really interesting study that they've done. They did something called a modified Gelbo flex method, where the subject, in this case a non-woven material, was subjected to twisting and compression action inside of a chamber. Then air was removed from the chamber. It essentially had a filter that would catch the particles that were removed during that testing. And that's how they determined something that was a low linting or non-linting item versus something that was a higher linting item. There was actually standards set by the ISO documents that state what is an acceptable standard for a non-linting cloth. If you want to go deeper in the weeds, that's definitely something I would recommend. Very interesting stuff about how they actually test a non-linting wipe. But just to kind of sum everything up for us, when you're utilizing a cloth for decontamination of instruments or devices, those terminologies, non-linting or low linting, are interchangeable. It simply means that your cloth that you're using should not be producing high amounts of lint. Again, if you reuse anything over time, eventually the usage will catch up to you and it will start linting. So I hope that clarifies the terminology of non-linting and how it differs from that quote unquote lint free. If you got something out of this video, please hit the like button so others might be able to find it. And then hit the subscribe button so you can be the first to get Healthmark education videos as they come out. Thank you for watching, and we'll see you on another Quick Tips.